All right, hello everyone. My name is Ralf. I'm a student physical therapist from the University of St. Augustine, working with co-health pediatric therapy with Dr. Amreen Carr. So today we're going to be talking about torticollis and the treatment options for the condition. So what is torticollis? Torticollis is actually just a shortening and tightening of the sternocleidomastoid muscle, or SCM for short. What it does is cause a head tilt to either side, wherever is tight, and then also some redness along that side. Overall incidence is fairly low, just below 1%, but can get as high as almost 2% in breech position births. Some common causes is positioning in the uterus with a small space for the baby to develop. Sometimes they are in that position there pictured and just come out from birth that way. There's also birth trauma from the breech position that we talked about. Positional preference just kind of throughout the day. Some babies, might just be favoring one side, and then a combination of trauma or compressing of the spinal accessory nerve. Here we have a little anatomy review. In the picture there, we have the SCM muscle that we talked about. So as we see, it kind of starts from along the base of the skull, just behind the ear, and then runs down along the neck and actually splits off into two, one part going towards more of the sternum and then the other part towards the middle of that clavicle. So what this muscle actually does is side bends the head as if you were bringing your ear to your shoulder, and then opposite rotation as if you were shaking your head no. And then torticollis is named for the side that the muscle is tight and where the head tilt is prevalent. Some types and severity. Postural is the mildest form, where a child has a positional preference but has full range of motion both ways, and the head tilt may actually not be present. Muscular torticollis is unilateral tightness of the SCM, and there would definitely be head tilt preference. And then the most severe is the nodular, where there's actually like a little knot that is present in the muscle there, and then a lot more range of motion restrictions there. Severity is graded 1 through 7. Grades 1 through 3 are actually diagnosed fairly early, from 0 to 6 months old, and then based on range of motion limitations after that. When it is diagnosed early, they have very good outcomes with early interventions. We typically say around 3 to 4 months to get them into therapy. Grades 4 to 7 are diagnosed 7 months and later, and then also based on severity of their limitations and the range of motion, and then usually take a little longer rehab process. Just being in that position for so long, the muscle does get a little bit tighter. And then as the child gets a little bit older, they gain their independence and start to resist a lot of the exercises that we try to do with them. And then preference to one side or head tilt usually presents around 2 months of age. Some secondary conditions that we are concerned about is plagiocephaly, or flat spots on the head. And then with torticollis, what happens, because the baby is in that tilted and rotated position, when they're laying on their backs, they tend to lay on just the one side of their head. And so it kind of develops a little bit quicker that way. We do have a source in town called Cranial Technologies. They are offering free head scans, and they recommend just to get a check regardless if there is torticollis or not. And with COVID, they are also doing online screenings. Children are also at developmental risk abnormalities. These include one side becomes stronger. So usually the opposite side of the torticollis becomes a little bit weaker than the one side. Kids adjusting to a new center. So for them being so long in this one position, that becomes their new normal. Risk for balance and coordination issues, and so on and so forth. And then also some visual deficits. So what we do in therapy and what we recommend at home, the first and foremost, we would want to stretch that muscle. So in that first picture there, we have the football hold position. So what it actually does is tilt the head away from that muscle. And so when you're doing this, recommended to hold their arm down. So when that muscle is tight, it'll also kind of hike up their shoulder. So you want to keep their arm down and then allow the head to stretch the opposite way. In the middle there, we have another position of where we're side bending. So again, making sure that arm stays down and then trying to turn the head away from the tight muscle. And then in that last picture is for rotation. So having the baby lay on their back and rotating it towards the side of tightness. So with, like I said, with that tightness of the SCM, we want to side bend away and rotate towards to stretch that muscle. And then again, for the rotation, there's also, you can press them up against yourself this way and then just have them hold their head against you. Anyway, which you can get your child to be comfortable and not squirm around too much. Continuing, we also want to strengthen. So I'm sure as many parents know, tummy time is super important. Trying to get them on their stomach as much as you can. I know some babies don't really like to tolerate it too much, but just throughout the day, getting them as much as you can. And then also again in that football hold, so after we stretch, we also want to strengthen the opposite side of the muscles. And so after you're done stretching, you can kind of let them go. And so it forces them to pick their head up and work the muscles on the opposite side of their neck. So we recommend doing these pretty much every diaper change, all throughout the day. The more often, the better, as with any tight muscle, the more you stretch, the better outcomes you have. And then in therapy, we also will be doing these similar exercises. Another thing you can do at home is whatever side the baby is tied on, to have everything opposite so that they are forced to look at that way. So whenever you're greeting them, you know, all their toys, their TV, anything to get them to get their head turned to the opposite side of where their tightness. Here are just some references. And then if there are any questions, you can always give us a call and we'll be happy to answer them. Thank you.